Okay, good afternoon, everyone. It's great to see so many of you here. I'm asking you to forgive me. I'm going to read this so that I don't mess up and leave something for chance. I'm Phyllis Khalifi. I'm President and CEO of the Children's Forum in Tallahassee. If you don't know who we are, you may know us by some of our programs that we administer, such as the Teach Early Childhood Scholarship Program, our Early Childhood Educator Incentives Program, formerly Child Care Wages, Help Me Grow Florida, the Early Learning Career Center in Miami-Dade County, the Professional Development Registry in Miami and Palm Beach County, as well as several other initiatives. We work closely with the Florida Office of Early Learning and the Department of Children and Families, the Children's Trust in Miami-Dade County, the CSC in Palm Beach County, and we appreciate your support for our efforts. We're excited to bring you this afternoon's webinar, Legal Considerations for Child Care and Early Learning in the COVID-19 Era, which is the first of 3 important topics for our summer webinar series. We feel like we've hit a chord with the need for this one as we maxed out our registrations for this one with 1,000. This is a new day for our field, and we know that early childhood centers and programs are struggling as they try to establish their new normal in this pandemic environment. So we hope you'll benefit from the presentation today and the subsequent presentations that you'll receive information about soon. But just before we get started, I have a few housekeeping items to mention. First, we're asking that you turn off your video and mute yourselves for this presentation. There's going to be a lot of competing bandwidth on this one. The PowerPoint will be distributed to everyone who participated after a few days after the meeting. So if you don't see it, we want to make sure you check your spam account because we'll be sending it out. We want you to use your chat box for all questions throughout the presentation. Moderators will read the questions aloud as we have time, and Karen will respond. Throughout the presentation, there will be a few questions that each of you need to answer electronically during the webinar, as we'll be providing certificates of participation for those who respond to all 3 questions of the electronically during this presentation. Certificates of participation will include the name you used to register for the webinar. So if you just used your initials A and Z, that's what you're going to get on a certificate of participation. The webinar will be recorded and available post-presentation on the Children's Forum website. But give us a few days for us to download it and post it. And the first poll question is designed to see who is really joining us on this webinar. But let me introduce to you today our speaker. Karen M. Busing is a partner at Ackerman in Tampa, Florida, has more than 35 years of experience in counseling and representing employers in the workplace law matters. Karen is only about one of 200 lawyers in Florida who are board certified by the Florida Bar as specialists in labor and employment law. Her expertise includes discrimination, harassment matters, hiring, firing, and disciplinary matters, leave and accommodation matters, wage and hour, non-compete, trade secret litigation, whistleblower and retaliation claims, and all aspects of counseling and training. She is currently on the Ackerman Return to Work Resource Guide team, assisting employers in navigating the reopening during this COVID-19 pandemic. She has also received several awards for her exemplary service, and one of them is that she's recognized as one of the attorneys in her field that has the most pro bono work. So we really appreciate that she is so willing to give us and devote some of her time to us. I do want to share that Karen's presentation is not intended to provide you with specific legal advice, but we'll do a broad overview of the things to consider as we navigate these uncharted waters together. Karen also happens to be married, I need to mention, to Bob Busing, who is also an attorney and the chair of the Children's Forum Board of Directors. He is a longstanding advocate for children and early learning in Florida. So now it's my pleasure to turn it over to Karen Busing, who's going to lead us through an enlightening presentation. Thank you, Karen.
My pleasure. Thank you so much for having me. I think my husband got tired of hearing me talk about this over and over and over again, and then and said, you know what, I think this organization would benefit from hearing it. So I am here to help you with your businesses as you either reopen or continue with providing services. Two things to keep in mind in the goal of this is that what we're trying to do is minimize exposure and the spread of COVID-19, while at the same time minimizing your exposure and to liability for claims, either by employees or parents or anybody who's using your facility. So we're looking at two different areas here that we're trying to cover. And there is a very aggressive plaintiffs bar out there looking for ways to go after all kinds of companies when somebody gets sick. And it's not necessarily anyone's fault, but that's what they're doing. And so we want to make sure that you're doing what you should be doing. And so I'm going to give you, as Phyllis said, an overview. And if you'll put my presentation up for me, we are ready to roll. The biggest things to keep in mind is that right now you want to do at least the minimum. And so that means you want to meet the standards that are currently set by both the Centers for Disease Control, the CDC, and OSHA. So if you can go to the next slide, please. And OSHA, back in March when this first happened, OSHA came out with guidance. And one of the things that they said back in March was you need to develop an infectious disease preparedness and response plan. That's going to help you guide against COVID-19. Next slide, please. They have continued. Can you put the next slide up, please? And then CDC, whoop, back up one, sorry. I'm not controlling this, so we're going to do the best we can here. CDC, the very next month, issued guidance saying, again, no matter what the level of transmission is in your community, every child care program should have a plan in place to protect staff, children, and their families from the spread of COVID-19. This is especially noteworthy because the CDC does not have specific guidance for every industry, but it definitely has specific guidance for your industry. Next slide, please. And then in June, OSHA issued new guidance on reopening in the middle of June. And a lot of employers aren't even aware of this, but all employers need to be aware of it. And they talk about during the process of reopening, what kinds of things you need to do. You have to implement strategies appropriate for your particular workplace. And the things that they are looking for include all of these. And I'm going to cover all these in bullets on a couple of slides. Hazard assessment for each job category. What that really means is taking a look at who's likely to be exposed and in what manner they're likely to be exposed to the coronavirus. And in your particular case, that's pretty easy to determine. In some kinds of businesses, there are multiple very different job categories with very different exposures. So don't be intimidated by the words hazard assessment. That just means look at the job and see what kind of exposure do these employees have in that job, and what can you do to implement protective measures. And if everybody would mute their microphones, it will help avoid some feedback. Again, they want you to determine where, when, and how your employees might be exposed. They want you to implement some basic hygiene, like hand hygiene, sneezing and coughing etiquette, cleaning and disinfection procedures, social distancing procedures, identification and isolation of sick employees, and policies for return after illness and exposure. Next slide, please. The reopening plan should include workplace controls, which can include engineering and administrative controls, less likely to be an issue for your workplaces. Sometimes it is a very critical issue. Personal protective equipment, again, depending on the particular employee's exposure. They want you to have a plan that addresses workplace flexibilities about telework, sick leave. Telework is not likely to come into play in your business much, except perhaps with respect to some administrative employees. Critically, they view training on the signs, symptoms, risk factors, and safety equipment and procedures as critical. OSHA is looking for all employers to train its employees, and that will be one of the minimum thresholds you really must meet. And then finally, anti-retaliation policy, basically that ensure that no adverse action is going to be taken against an employee who raises workplace safety and health concerns. So let's go on to the first section here. And I'm going to kind of blow through. Next slide, please. Next 2 slides. This is the CDC guidance for childcare programs, and I have copied and pasted a lot of it in these slides. I'm not going to try and cover it in great detail. You can take a look at it and you will get copies of the materials. And you can go right to the CDC website and click on the childcare. Somebody's got their mic open, so if you could please close your, mute your microphones, that would be very helpful. All child care programs should implement social distancing strategies. They should intensify cleaning and disinfection efforts. They should modify drop-off pickup procedures, and they should implement screening procedures upon arrival. Next slide, please. The CDC recommendations include very specifically each of these things: maintaining an adequate ratio of staff to children. They want you to be sure to plan ahead so that you have substitute caregivers on hand who can fill in if a staff member is sick or must stay home because they have a sick family member. When feasible or mandated, which is pretty much everywhere, wearing face coverings within the facility.
Karen, I'm going to jump in for a second here. We've got a lot of background noise. Sorry to interrupt, but if you are on your telephone, you need to mute yourself. We can't do that from here. We can't anyone on a computer. If you're on a telephone, please mute yourself. We can hear everything.
Okay, that's great. Thank you. Yes. Again, when feasible or mandated, which is pretty much everywhere now, staff members and older children should be wearing face coverings within the facility. Somebody still got their phone unmuted. Cloth face coverings obviously shouldn't be put on babies or children under the age of 2 because of the danger of suffocation. Next slide, please. The CDC website on child care centers has a lot of very specific details. They have social distancing strategies, and these are some of the suggestions that they have. Having child care classes that include either the same group each day. If you can't do that, considering whether to take care of only children of healthcare providers or first responders who have a greater risk of exposure, but not mixing those kids. Canceling, postponing events such as festivals, holiday events, those kinds of things. A lot of this is very obvious. Next slide. Considering whether to halt daily group activities that could promote transmission, grouping kids in separate rooms, limiting kids on the playground, staggering their times, nap time, spacing out mats, those sorts of things. Next slide, please. Obviously, they suggest that you plan for curbside pickup and drop off to limit direct contact between parents and staff members. Next slide. If possible, arrange for the administrative staff, again, if they can, to telework from their homes. And then setting up hand hygiene stations where in the obvious places, obviously at the entrance of the facility, have sink and water or hand sanitizer next to parent sign-in sheets, keep it out of kids' reach, obviously. All of these things are fairly obvious. Next slide, please. Consider staggering drop-off and pickup times and plan to limit direct contact with the parents as much as possible. Have your child care providers greet children outside, designate a parent to be the pickup or drop-off volunteer. Infants can be transported in car seats. Again, all of these are suggestions on the CDC website. Next slide, please. It is very important that you screen children and visitors. Persons who have a fever of 100.4 or above or other signs of illness should not be admitted to the facility. Now, I'm going to stop here and say that I'm talking about federal guidance. But there are some places in Florida which have considerably more restrictive guidance. For example, in Miami and Miami-Dade, there are local requirements for businesses. I have not looked to see if they specifically address child care centers, but either Miami or Miami-Dade, one of them says you can't let people in if the temperature is above 99.5. It is a much lower standard than the federal one, which is 100.4. So you've got to pay attention to your local guidance too. Obviously, you want parents to be on the alert for signs of illness in their children, and you want to tell them to keep those kids home when they are sick. And again,
Excuse me.
Yes.
I'm sorry. I just wanted to add to what you just said. In Volusia County, it's the same. It's anything over 99.
Right. So you've got to be alert again for your local guidance. It can be different from county to county, city to city. So be alert for that. This is all just from the federal guidance here, but this is again going to be the minimum, but you need to be paying attention to your local guidance, which is going to be based on how severe your community spread is. Next slide, please. Again, among the social distancing, I'm not going to go through these next 3 or 4 slides. They have some specific examples of ways to do social distancing and taking kids' temperatures, asking the parents to confirm the child doesn't have fever, making a visual inspection, all those sorts of things. One of the things that they note is you don't need to wear personal protective equipment if you can maintain a distance of 6 feet. Well, you can't really take somebody's temperature with one of those thermometer guns if you're 6 feet away. So the person doing that will need personal protective equipment. Next slide, please. These are additional suggestions. There's a barrier or partition method for taking it. Next slide, please. And then they have another, next slide, please. Another example, when you don't have social distancing or barrier partition controls available to you, you can use personal protective equipment and be within 6 feet. They want you to remember that reliance on that alone is less effective and more difficult to implement because of PPE shortages and training requirements. Keep in mind that anyone who is taking someone's temperature should be wearing gloves, which are changed each time, or they should be washing their hands each time. You need to make sure that they are taking extra steps to protect themselves and those with whom they are interacting. Next slide, please. Again, this is part of the CDC's example number 3 when you're relying on personal protective equipment. Cleaning the non-contact thermometers, all of those things are pretty obvious. Next slide, please. Again, this is directly from the CDC website on if you want to rely on personal protective equipment, the steps you need to take. And they are all fairly obvious. So if you don't have specific guidance, again, look at the CDC website. They're going to tell you exactly, if you're depending on one of these methods, exactly what you should be doing. Next slide. In addition to screening your families as they're coming in, you want to make sure that you are cleaning and disinfecting. The CDC cites to this Caring for Our Children as an organization that provides national standards for cleaning and sanitizing of educational facilities. Again, some of this is pretty obvious. Toys that can be put in the mouth should be cleaned and sanitized. Other hard surfaces, obviously, including diaper changing stations, doorknobs, floors, those things can be disinfected. Next slide, please. During this time of COVID-19, you obviously want to intensify your cleaning and disinfection efforts. So develop a schedule, make sure you have that, make sure it's very much routine. Commonly touched surfaces should be cleaned frequently, much more than you otherwise would. You can use the cleaners that you typically use at your facilities. If you need guidance on the selection of appropriate sanitizer or disinfections for childcare settings, again, the CDC has got these. Most of the things that are in red on my slides are live links on the CDC website, so they will take you directly to specific information. Next slide, please. Be sure that you or whoever is doing your cleaning is using the cleaning products according to the directions on the label. Most EPA registered fragrance-free household disinfectants are going to be effective. COVID-19 disappears with soap and water. So hopefully we're not going to have a problem with that. If surfaces are dirty, they should be cleaned using detergent, soap, and water prior to disinfection. Again, follow the manufacturer's instructions for concentration, for the application, and the contact time for all cleaning and disinfection products. Next slide, please. They recommend, if possible, providing disposable wipes to childcare providers and staff members, again, to be using on frequently touched surfaces like keyboards and light switches, remote controls, those kinds of things. If those are not available, and for a lot of folks they still are not, there's some additional guidance available on the CDC website. I personally carry around this dish towel that's soaked with bleach and water, a combination of bleach and water, and I use it to open doorknobs and to push elevator buttons and all of those sorts of things. Obviously, you want to keep cleaning materials secure and out of the reach of children, and the cleaning products should not be used near children because you want to make sure that they don't have these ventilation issues. If you are doing cleaning, you obviously want to make sure, just like if you were cleaning at home, you're using a well ventilated area. Next slide, please. You have the additional obligation in the child care center of cleaning and sanitizing toys. Again, these slides are directly from the CDC website, so I'm not going to go through them in great detail. They are pretty obvious. You want to clean those things, with water, detergent, disinfectant, sanitize them. Be mindful of those things that are going to be placed in a child's mouth. I wouldn't use the same cleaner on those if you're going to put it in their mouths. Washable toys should be machine washed between children's use. Next slide, please. The CDC recommends that toys not be shared with other groups of infants or toddlers unless they are first washed and sanitized. Obviously, you should set aside those toys that need to be cleaned in between use, and you can wash them with soapy water and make sure you have enough to rotate them through the cleanings. Children's books, other paper-based materials, and mail and envelopes. The CDC says those are not considered a high risk for transmission and do not need additional cleaning or disinfection procedures. Now, that's right now. I will remind everybody that things have changed as we have learned a lot more about the virus and the way that it works. And so that could change again. If you will recall that until very recently, the CDC said that the primary means of transmission of this virus is when people coughed or sneezed, and then others inhaled the molecules that they left. Just in the last 2 weeks, the CDC has modified that to say that it's commonly transmitted by people coughing, sneezing, or talking. And we know from several news stories, singing also is a problem. So it is easy to transmit this virus, and we want to take extra precautions. Continuing with the CDC's guidance on cleaning and sanitizing toys, it's ideal not to share them among groups until they are washed and sanitized. I've already covered that part. Next slide, please. The bedding also needs to be cleaned and disinfected. That's obvious. And somebody mentioned playground equipment. Of course, playground equipment should be cleaned too. In a perfect world, you have one group of kids, then you clean the equipment, then the next group of kids, you clean the equipment. Again, all this is on the CDC website. Next slide, please. The CDC also talks about the steps you should take in caring for infants and toddlers. Again, pretty obvious, washing your hands before and after diapering children. Next slide, please. Washing your hands again. If there are other sanitizing products, make sure you're using those. Cleaning surfaces with soap and water before disinfecting them. Those are all some very basic things, again, on the CDC website. I would encourage you, as you develop your own COVID-19 plan, to look at that website and to figure out what safety protocols you want to put in place and put those in your plan. Okay, next slide. Now we're going to talk about that plan, because again, the current standard, yes.
Karen, we have, now's a time for another poll.
Okay.
So we're going to interject real quick before we start to the next section, another poll. So, okay. So have you discussed and or written a COVID-19 preparedness and response plan for your facility or early learning program?
Hope everybody said yes, so that we don't have to, but I'm just guessing that probably not.
Okay, it looks like a majority of the folks responded. 87% said yes, with about 13% no. So this is important for everybody to hear. So good.
Okay.
Thank you, Ken.
All right, very good. We'll those of you who've already developed your plans can check those against the checklist that we're going to go through here. So next slide, please. What do you need to have in your COVID-19 plan? Number one, identify a COVID-19 monitor. You can call them whatever you want. A COVID-19 monitor, a COVID-19 czar, whatever you want to call them. You need a point person that people can go to if they have a question or they have a concern. You want to conduct your hazard assessment of each job. Again, that's required by the OSHA standard, and the hazard assessment's very simple. It's just a question of looking at the job and figuring out where their potential for exposure is and how you can minimize it. You want to make sure you identify your safety protocols. I'm guessing most of you who have a plan have done that. You've established that. Train your employees on the plan. That is one of the OSHA suggestions. They want to make sure that everybody who's got a plan has been trained in both how you can minimize exposure to COVID-19 and what are the safety precautions that the employer has put into place. And then my personal recommendation is this, that you have employees acknowledge that they have received and reviewed the plan. You want to share it with them, make sure they've reviewed it, and have them acknowledge their obligation to report safety issues or concerns. Because if they become aware of something, you want them to tell the COVID-19 monitor. And so it's ideal to have them specifically acknowledge that they've received and reviewed the plan, they understand their obligations with respect to washing their hands and all of those sorts of things, and that they understand that if they become aware of a safety issue, that they will report it to the COVID-19 monitor. Next slide, please. Your plan protocols should address all those things in the CDC and OSHA guidance. Again, CDC has express guidance for child care facilities and pre-arrival screening, social distancing, pickup and drop-off procedures, cleaning and disinfection procedures. Next slide, please. The CDC and OSHA and the EEOC all recommend that you have daily health screening for your employees, and many child care facilities are also doing it for the kids and parents. So this is a sample of a daily health screening checklist. You would ask, are you or your child experiencing any of the following symptoms? Now again, notice these are the symptoms that are currently identified by the CDC as the symptoms of COVID-19. They change, they have changed on several occasions. So keep your eyes on those symptoms. Then I recommend asking if in the previous 14 days, have you or your child had any contact with someone who at the time of the contact had a confirmed diagnosis of COVID-19 or had symptoms and was awaiting the results of a test. Or you could ask them if they're ill with a respiratory illness. And if so, were you or your child wearing the appropriate personal protective equipment? Another question that I recommend asking is if in the previous 14 days have you or your child traveled to a state or international country with widespread sustained community transmission, or if you've been on a cruise ship, because you don't want folks coming into your facility who have been on a cruise ship or who have traveled to a state where there is widespread community outbreak. You want them to stay home and keep their kids at home. Keep in mind that if you ask, and you should be asking your employees these same questions, but all your medical information about employees must be maintained in a separate confidential medical file. It has to be separate from your regular personnel file. That's under the Americans with Disabilities Act. And whoever's doing things, gathering this information, if you're gathering it, or whoever's asking the questions, needs to understand that they have an obligation to maintain the confidentiality of it. They can't turn around and tell another employee, oh, so-and-so had a fever of 100.5. Oh, so-and-so is sick with respiratory symptoms. Oh, so-and-so went to get a COVID-19 test. You cannot share that information. It is illegal to do so. Medical information regarding employees must be maintained in separate confidential medical files, separate and apart from their regular personnel files. Same thing with respect to medical information regarding parents and students under a different law must be maintained in confidential files. My bottom line recommendation on that is don't retain that medical information. Don't retain information you don't need. So for example, if you ask people the series of screening questions, ask your employees before they come to work, to self-assess. Do you have a fever in excess of 100.4, or if you're in Volusia or Dade or one of these other places where the number is lower, have you got these symptoms? Have you traveled? You ask your screening questions, and if they can answer no, then they can show up to work. Don't ask for medical information you don't need. If the answer is yes to any of those questions, they need to just contact their doctor if they have a medical symptom, and you don't need to retain that information. All you need to know is that they're not going to be there and you've got to arrange for coverage. So don't retain medical information that you don't need. If you do retain it, be sure you maintain it as confidential and do not share it or allow other employees to share it. The people who are taking temperatures need to understand they cannot share that information. Next slide, please. I recommend that you adopt rules for illness so that anybody who is displaying any sign or symptom related to COVID-19, even though it probably isn't going to be that, I mean, it could be just a common cold, but you should have them removed from the classroom. And no one should be permitted to return until they meet appropriate return criteria. Next slide, please. I would also recommend that part of your COVID-19 plan include tips for parents while the children are not at your program or facility. Among the tips that I would recommend including are telling people to practice social distancing. I would add wearing a mask, practice hand washing, sneeze and cough protocol. Children older than 2 should wear cloth face coverings when not at home. Same thing with adults. Encourage the kids to play outdoors. The likelihood of transmission is much less. Parents need to be good role models and they need to understand that. And then the critical one I put in the bottom in red is to watch your child for any signs of illness. And if you're concerned that your child may have COVID-19, to stay home and contact healthcare providers. Next slide, please. Again, share your COVID-19 plan and protocols with parents. My suggestion is that you craft a participation agreement for parents to sign on behalf of themselves and their children. And that, next slide, please. That kind of, think of a YMCA or a skydiving or a fitness center, anything like that. The kind of agreement you sign when you go there. And basically the parent would affirm that they've been furnished a copy of your plan, which has, you know, you're supposed to screen your kids and you're supposed to make sure that they do this, that, and the other, and drop off and pick up and observe all the rules. And by enrolling their child, they're agreeing to comply with those protocols that are set forth in the plan. And then I would have them do just like you would in any other waiver form at a gym or something like that, is that you would have the parent acknowledge the risk of illness or injury, expressly waive any claims that release the owners, operators, and employees from any cause of action arising as a result of participating in the program or activities, include an express COVID-19 waiver and an express acknowledgement of assumption of risk. Next slide, please. I want to tell you that just because I'm suggesting you have such a participation agreement doesn't mean it will work. Courts scrutinize these kinds of waivers very carefully. They want to assure that they were knowing and voluntary, so the person signing it, and this is not for employees, this is for parents. Did they understand what they were signing? So it has to be written in plain, clear English and address exactly what you're talking about. The courts will ask whether they're against public policy. And keep in mind that a waiver will not release an owner or operator from intentional or reckless conduct. So how is intentional or reckless conduct established? They look first to see if you've complied with state and local and federal guidance. So you want to make sure that you are complying with state, local, and federal guidance to avoid any argument that you engaged in intentional or reckless conduct. So that's my recommendation on that. Next slide, please. Okay, exposure in the workplace. Several people have asked questions about this. I'm gonna cover it briefly, but I wanna caution you that it keeps changing. Next slide, please. So if you have somebody who tests positive, or you have one of these, you're not sure what to do, go to the CDC website and look at what they recommend. So right now, employees should be instructed that if they, did we skip one here? That if they have, no, okay, first slide, okay. Employees should be instructed that if they have close contact, that means consider it basically 6 feet for 15 minutes or more, with anyone with a confirmed or suspected case of COVID-19, they should not report to work. Confirmed or suspected. By suspected, I mean somebody has symptoms and they've gone for a test, okay? Because it's very different for somebody who doesn't have symptoms, all right? You are required to report positive tests to the local health authorities. That is the only person to whom you can disclose the name of the individual who tested positive. Again, you should not disclose the name of positive individuals to anyone other than health authorities unless that individual consents in writing. Now, I will tell you that the bulk of my clients where this has happened, the employees are fine with sharing their names because they care about their coworkers. Every once in a while, there's someone who says, nope, don't share my name. But you cannot share the person's name unless that individual consents in writing. Why would you want to share their name? Well, what you're trying to do is notify people who have been in close contact who might themselves need to monitor themselves for symptoms, but you can't disclose the name of the person with whom they were in contact who tested positive for COVID-19 without their express consent. Next slide, please. Okay. So if you find out that you have an employee who's tested positive, you need to determine who may have had close contact with that positive employee in the period commencing 48 hours before the onset of symptoms. So again, if it's without symptoms, it's different. You should direct anyone who had close contact with that positive employee to quarantine for 14 days from the last date of close contact with the employee. And this can wind up with that person being out more than the person who's been COVID positive, but that's complicated to explain. I'm not going to try and do it. You should definitely notify parents who may have had close contact with the confirmed positive employee. Again, we're talking about someone who has been within 6 feet for 15 or more minutes. So most parents should not fit that bill if they're just picking up and dropping off and you're limiting who is doing the pickup and drop off. Next slide, please. If an employee exhibits COVID-19 symptoms, this is the current guidance. An employee must remain at home until symptom-free, 72 hours without the use of fever-inducing or symptom-altering medicines and at least 10 days have passed since the onset of symptoms. Now, here's my recommendation. You may not want to allow an employee who had symptoms to return to work without a doctor's note confirming the employee does not have COVID-19 and releasing the employee to return to work. The hard part about that is, as we have another surge going on, it's going to be harder and harder for people to get into a doctor to get that kind of a note. So that is the CDC and OSHA discourage employers from requiring that. As an employer, you have an obligation to provide a safe workplace to your employees. So the default position from my perspective is you do want to require that if in your community it is feasible. Next slide. If an employee tests positive, you should make sure they are self-quarantining away from work. You should tell them to consult their doctor. Employees who test positive but are symptom-free can return to work when at least 10 days have passed since the date of their first COVID-19 diagnostic test, assuming they haven't subsequently developed symptoms. There is another criteria involving 2 negative tests. If they develop symptoms, the return to work criteria for symptomatic employees applies. Again, this is very complicated and it changes. So it may have even changed since I put this presentation together last week. So I would encourage you to go to the CDC website if you have an employee who tests positive. They tell you exactly when somebody can go back to work, and it depends on whether they had symptoms, didn't have symptoms, had a test, didn't have a test. Next slide, please. Okay, again, this is another batch of what you can do. If somebody tests positive and wasn't self-quarantining but was rather hospitalized, you've got to get their medical provider to tell you when they can come back to work, because typically they've had much more severe symptoms. Persons who test positive, we recommend not be permitted to return to work, again, without a doctor's note confirming the person doesn't have COVID-19 and releasing them to return to work in writing. That's my recommendation. Again, it may or may not be feasible in your community. It's certainly the conservative approach, but it may not be realistic for everybody. And plus, a lot of these employees may not be able to get in to see a doctor. It's that simple. So next slide, please. We have a lot of calls about people who had contact with somebody who tested positive. So contacts of contacts or contacts with persons who actually tested positive. They're 2 different things. So if an employee learns that he or she has come into close contact with a confirmed positive individual outside the workplace, you should have them alert the people. I'm sorry, I've got a typo in there. Alert the people who were close to that contact. Again, 6 feet for 15 minutes or longer. Anybody who has come into close contact with an individual who's tested positive should be directed to self-quarantine for 14 days from the date of last contact with the individual. Contacts of contacts are not the same. The CDC currently does not recommend that you quarantine people who were contacts of someone who was a contact who had COVID-19. Next slide, please. Okay, I want to jump to the Families First Coronavirus Act because, Coronavirus Response Act, because I know that a lot of employers are having issues with this. This is that new law that came into effect that requires private employers with fewer than 500 employees and certain government employers to provide paid leave to eligible employees. There's 2 different kinds of paid leave: emergency paid sick leave and emergency FMLA leave. Small businesses with fewer than 50 employees may qualify for an exemption from the requirement to provide leave, but only with respect to the loss of childcare section. So, and I'll jump through those real quickly, and only when it would jeopardize the viability of the business as an ongoing concern. So next slide, please. Let me just go through this real quick. So emergency paid sick leave, there are 6 reasons under the statute for which one can get emergency paid sick leave. It's up to 80 hours of the regular rate of pay, and it's only where the person is both unable to work or telework. And it's for these 6 reasons, but there's really only 5 because the 6th one doesn't exist. Number 1, the employee is subject to a federal, state, or local quarantine or isolation order. That is not the same as you saying, oh, you went to North Carolina you have to quarantine for 14 days. That is not a federal, state, or local quarantine or isolation order. It is not a government order, okay? That is a person made a choice to travel when they knew that they would have to self-quarantine. That's not the same thing. Number two, the employee has been advised to self-quarantine by a healthcare provider due to concerns relating to COVID-19. Or number three, they're experiencing symptoms of COVID-19 and are seeking a medical diagnosis. Next slide, please. Next slide, please. The employee is caring for an individual who's subject to a quarantine or isolation order, or the employee is caring for a son or daughter if the school or place of care has been closed or the child care provider is unavailable due to COVID-19 precautions. So this was a very big deal earlier on. Now many of the facilities have reopened. Summer camps have reopened, all those sorts of things. But this one, number 5, which I'm going to call loss of childcare, that is the one for which the small business exemption is available, loss of childcare. Number 6 is in the statute, but there is no yet substantially similar condition that's been identified. So really, emergency paid sick leave for just those five circumstances. Next slide, please. I'm gonna blow through these because you will have all these. Again, this is in addition to an employee's other leave entitlements. Next slide, please. There is also a bucket of expanded FMLA leave. This is if employees who've been employed for at least 30 days get 10 weeks, up to 10 weeks of paid expanded FMLA leave at 2/3 their regular rate of pay if they have lost childcare. Again, very limited to the loss of childcare. And again, the small business exemption applies. Next slide, please. I want to leave some questions here, because leave room for questions. I'm going to fly through all these issues that may arise. Y'all can look at those later on. Next slide, and next slide, and next slide, because I want to leave some time for questions. Next slide. Yes, everyone will get the PowerPoint afterwards. Next slide. Small business exemption. Okay, this again allows an employer with fewer than 50 employees to be exempt from providing emergency paid sick leave and expanded FMLA leave, but only for the loss of childcare reason, and only when doing so would jeopardize the viability of the small business as a going concern. Next slide. So to use this exemption, it's you've got to show that providing leave would threaten the company in one of 3 ways. The leave would result in expenses exceeding your revenues. The absence of the employee would entail a substantial risk to the capabilities of the operations because that person has unique skills or responsibilities, or there would not be enough other qualified workers available to perform the work. Next slide. This is an employee-specific exemption, not a broad across the board, our business should be entitled to it. So if somebody requests the leave, you have to look at that individual. And then you can deny it based on those 3 things. And then you need to make that determination, document the reasoning, and maintain it in the company records. Thank you very much. Next slide. I think we can probably, oh, and there you go. I am at the point, again, reminder, this is for informational purposes only. This does not constitute legal advice. We do not have an attorney-client privilege. It's not intended to substitute for legal advice. This is based on the current guidance that's out there. And I'm just trying to help you be aware of what that is. And at this point, I am going to open it up for questions. And I think, Phyllis, y'all are going to handle those and just lob them to me. Phyllis, you guys are mute.
Yeah, okay, now I think we got it now. Okay, there's the last polling question before we get to other questions. Having participated in this presentation, do you feel better informed about the legal considerations for childcare and early learning programs in the era of COVID? So we want to see, did we help you get to what you needed to know? We know that this has been a very quick presentation in terms of the depth of this information, but it's intended to provide you an introduction. And then Karen is going to answer a few questions for us as time allows. Let me see, it looks like 98% of you, 97% felt like, yes, this has helped you get what you needed and become more informed. Okay.
Wait, only 7%?
Yeah. No, 97%.
Oh, 97%.
Yeah. No,
Oh, that-
not just 7.
Okay.
Okay, one of the questions, Karen, was, is there an example plan that you can share or recommendations where to find one in terms of setting up their own plan?
Yes. In fact, I can give you a free template. So if you go to Ackerman Return to Work Resource Guide, put that in your browser. There is a blank template. It is not for a child care facility, but there is a blank template for a return for a COVID-19 preparedness and response plan.
Wonderful. That's great. Okay, do we have any other questions? We're coordinating those questions here. Let's see. Excuse me. This one. Okay, we already said that one.
You can use Google or any other browser. Just put return to work Ackerman, A-K-E-R-M-A-N. That's my law firm, Return to Work Ackerman, and it will pop right up. It's called the Return to Work Resource Guide. There are probably 30 or 40 different free templates on there for different things.
Okay, Gigi, no, we might be able to unmute you, Gigi, so that you can mention your question. Let's unmute her. Okay, Gigi, can you hear us, or let's see if we can hear you? Okay.
I have forgotten my questions, unfortunately.
Okay, let me refresh you.
There was something that came up in this about workman's comp. Where does workman's comp fit into all of these?
Okay. So workers' comp is really important. You want people to be covered by workers' comp because that shields you from outside liability. If somebody gets COVID-19 at work, they have to be able to show they got it at work. Some states are changing the law so that there is a presumption one way or the other. There is a move to create some limitations on liability. But for now, and you don't want to ask your employees to waive their rights under workers' comp. You don't want to ask them to waive their rights under OSHA. That would be unlawful. You shouldn't do that. And you want there to be workers' comp coverage because that shields your business from other liability. So at this point, it remains to be seen because, as you know, it's very hard to tell where somebody got workers' comp. I mean, where somebody got COVID-19, but it's out there and it is there to protect your business.
And I just remembered one of my questions that has really been weighing heavily. And I loved, Karen, that you opened with our two goals were to contain the spread of COVID and to sustain our businesses. But some of our budgets are based on certain group sizes.
Right.
And those group sizes, because of the way children move and because of just the way a child care program interacts during the day, I don't even know whether keeping the group small would keep the children socially distanced. But at 35 square feet per child, which is a regulation, that's not enough room to, you're not minimizing the spread by that. And yet if you don't honor the number of children that you need in a room to make payroll, that's where this is, a very gray area. So when you say we're following CDC guidelines and OSHA guidelines, that gets to me. Like, what do we do? Do we protect the children or do we protect the business?
That is a very tough call. And I think that what's going to happen is that even though plaintiffs' lawyers are going to be out there suing businesses trying to recover. I think the reality is that this is so broadly felt by so many businesses that if you are taking steps to protect the kids, you are putting the priority in the right place. That's my personal opinion. There is currently a move to have some limitations on liability for businesses with respect to COVID-19, which would help. I think that to the extent you can comply with the CDC and OSHA guidance, I think it's really important to keep these businesses open because the economy has to function, and without childcare providers and early learning, you're not going to function. So I think it's really critically important to do what you need to do to stay open.
Thank you.
Thank you.
Karen, another question that has come up is, how do we deal with filling positions left vacant by teachers who don't want to come off the unemployment benefits? Because if they fill the position, do you have any responsibility to the former employee if they have chosen not to return to work?
Wait, say that one again, Phyllis.
Okay, so how does an employer deal with the positions are left vacant? And so then there's a need for them to return to work, but the teacher doesn't want to come back because they are making or earning more on unemployment. So if they fill the position, is there any obligation to that person later on?
No, there's no, if you ask the person to come back and they decline, you fill it with somebody else, you terminate that person. I mean, that's the same as job abandonment.
Okay. Okay, that sounds good. Do we have any others real quickly? We have about 1 minute left. Let me see. Okay.
I'm just looking at one that's popping up on the screen. No, if you have a child that has a runny nose, do not require COVID testing. First of all, COVID testing is, let the doctors decide when people should be tested for COVID testing. If a doctor looks at the kid and says this kid just has a cold, he can go back to school in 24 hours. That's fine. You don't need to have him tested for COVID. Let the doctor decide that.
Okay, one last question. If a teacher tests positive and he or she and assistants are sent home to quarantine, does the owner have to pay for 2 weeks at full-time pay for all of them, for the teachers and assistants?
No. Okay, so let me go back to the slide that had the 6 reasons, okay? The only time you have to pay somebody, so you'd have to pay the person who tested positive, okay? Because that person has been advised by a healthcare provider to self-quarantine, so that person gets paid during the period of time they have to self-quarantine, which may not be as long as 14 days. It just depends. If they don't have symptoms, it's going to be less. Okay, the persons who are the aides, they are not subject to a federal, state, or local quarantine or isolation order. They have not been advised by a healthcare provider to quarantine. They are not experiencing symptoms and seeking a medical diagnosis. They aren't caring for an individual who did that, and they aren't caring for a child whose place of care is closed. They are not qualified for emergency paid sick leave or expanded family and medical leave if they were simply people who were there. Now, you want to pay these people because you want them to come back? That's a different question.
Great, thank you. I think that's all we have time for today. Karen, again, we extend our sincere appreciation to you for your time and your effort in the preparation of this presentation that I know will be very beneficial. If there are other questions later that we can answer, we will, in terms of those who have put some information in the chat box. But again, thank you so much for being with us. We really appreciate it.
It's my pleasure, and thank you.
Okay. Bye-bye, everyone.